Hello, this is Kaydence LeBlanc, and this is my final project topic, which I chose schizophrenia spectrum disorders because it was the topic I was most interested in learning about. Um, they are a group of serious psychological disorders that affect how a person thinks, feels, and behaves. Once again, this is my final project for Sci 105, or Introduction to Psychology, with Dr. Reardon. Let's get into it. In this chapter, the main learning objectives include understanding what schizophrenia spectrum disorders are, recognizing the different types of symptoms that come with the disorder, explaining the causes, and discussing treatment options. I will also address common misconceptions and how this topic relates to our broader learning goals in the class of psychology. Schizophrenia spectrum disorders are a group of serious mental health conditions characterized by disruptions in people's thought processes, perceptions, emotional responsiveness, and their behaviors. The spectrum includes schizophrenia itself, but there are also other disorders that are included in the spectrum, which are related disorders like schizoaffective disorder and brief psychotic disorder. These disorders can significantly impact daily functioning and people's quality of life. Positive symptoms refer to behaviors or experiences that are added to someone's life because of the disorder, which involve hallucinations, delusions, and possibly some disorganized speech when speaking. Hallucinations often involve hearing voices that aren't actually there or seeing things that aren't actually there. Negative symptoms involve the absence of normal, regular behavior in people, like emotional expression or motivation, and also not wanting to be as involved in social gatherings and places. Cognitive symptoms affect people's thinking skills, including having problems with memory, their attention span, and their decision making, which can make daily functioning very difficult. There is no single cause of schizophrenia. Research shows that biological factors, such as genetics and dopamine imbalances in the person's brain, do play a major role in if they're more susceptible to get the disease. Environmental factors like prenatal stress, trauma, and substance use or abuse can also increase risk, especially in individuals who are already genetically vulnerable. Although schizophrenia is a chronic condition, treatment can generally reduce symptoms and improve quality of life, which is great news. Antipsychotic medications are commonly used and effective, along with psychotherapy and social support from either their community or their people that are closest to them. Early diagnosis and treatment are especially important for better long-term outcomes. This topic connects to our overall course learning objectives in psychology by helping us understand the relationship between the brain and behaviors, applying scientific methods to mental illnesses, and emphasizing the importance of reducing stigma through education and awareness. And the mental health branch of psychology is very important to know about because we all have brains and it's important to know what affects them and how to treat them. In this presentation, I defined schizophrenia spectrum disorders. I discussed the different types of symptoms, explained their causes, and reviewed different treatment options. Understanding these learning objectives help us better understand severe mental illness and reduce stigma. Overall, understanding schizophrenia spectrum disorders is essential for promoting empathy, scientific understanding, and effective mental health care. I had a lot of fun researching this spectrum of disorder, and I hope that you enjoyed the video. Thank you, and bye.